Hello everyone, this is Dr. Wala Adri. Today's topic is soft tissue injuries and wound healing. We're going to discuss different types of soft tissue injuries and the most common soft tissue injuries and how to manage and the types of wound healing and factors affecting it and recent advances in management. There are different classifications of soft tissue injuries, starting with the mechanism of injury, legal classification, and if it's communicated with the external environment or not, and according to official subunits and associated injuries. Also another classifications including CDC classification, Center of Disease Control, and Rank and Wakefield classification. According to mechanism of injury, there is mechanical injury, thermal, chemical, explosions, or miscellaneous injury. Mechanical or physical injury caused usually by blunt or sharp object on a part of the body, like abrasions, contusions, or lacerations. The thermal injury usually caused by any of the extremes of temperature, like severe increase in temperature like fire, or severe decrease in temperature like cold or frostbite in either moist or dry forms. Chemical injury usually caused by corrosive acids or alkalis. Explosions as blast injuries, miscellaneous like electricity and lightning injuries. Dangerous injury is the same as grievous injury, but it immediately endangers the patient's life. According to the communication of the wound with the external environment, there is closed wound and open wound. In the closed wound, there is no communication with the external environment, and the tissues is intact, like the skin is intact, and there is trauma in the subcutaneous tissues, forming hematoma, contusions, or due to crush injuries. These injuries usually is not contaminated unless it is open to another internal contaminated environment, like opening to the GIT or urinary tract. In the open wounds, there is break in the overlying skin with communication with underlying structures like muscles, soft tissues, or bone to the external environment. Like these wounds include lacerations, avulsions, punctures, and abrasions. And here is the high risk of infection due to this communication, and these wounds also tend to heal with scar due to the nature of healing of this type of wounds by secondary intention, and this wound need also careful debridement and antibiotic prescription to fight this infection. According to the facial subunits involved in the soft tissue injury, the face or head and neck region can be classified into different units or subunits, like scalp region, forehead, nose, periorbital, cheek, perioral region, etc. And to achieve good aesthetics after repair of the soft tissue injury, these subunits must be considered during management of soft tissue injury and during suturing of this injury, and this should be constructed one by one in case of complex soft tissue injuries. However, during wound examination, there should be examination for another concomitant or associated injuries, like there may be underlying nerve injury, venous or arteries injury, or in the facial region, in the cheek region, there may be parotid duct injury. Nerve injury must be carefully evaluated, like facial nerve or trigeminal nerve, each in its specific anatomical location. Artery venous injury should be searched for any bleeding or oozing bleeding to ligate it and stop bleeding. Also in the cheek region, we should examine the cheek internally very carefully to examine if there is parotid duct injury, like in deep laceration of the cheek. Otherwise, there may be complication like retrograde infection to the parotid duct or later mucocele formation. Like we see here, any lacerations in this line, imaginary line connecting the tragus of the ear and the upper lip, any lacerations in the cheek in this region, there is high risk for injured parotid duct, in which laceration could be managed by insertion of the elastic stent between the two ends of the duct and suturing over the stent to keep it open during complete wound or duct healing. Based on rank and Wakefield classification, there is tidy and untidy wounds. Obviously, tidy wounds caused by sharp instruments, and management is performed by primary closure and approximation of the edges, like the surgical incision. The untidy wounds usually caused by crushing, tearing, avulsion, trauma, and there is devitalized tissue that should be removed first before approximation. According to the Center for Disease Control or CDC classification, there is clean wound, clean contaminated or frankly dirty wound. In the clean wound, the surgeon follow aseptic technique and there is no contamination. In the clean contaminated wound, there is minor break-in asepsis, either opening or minor opening to the GIT or respiratory tract, where there is a passage of these pathogens from these tracts to the wound, or grossly contaminated, there is major break to the GIT, respiratory or biliary tracts, or the surgeon performed incision in case of acute infection and didn't wait till the subside of the acute infection or conversion to chronic one, or surgical site foreign body contamination or foreign body left behind within the wound, like devitalized tissue or remnant from an accident, frankly dirty wound due to active infection or pus presence in the wound, retained foreign body or fecal contamination, or even viscous rupture. Now, what are the common soft tissue injuries? Number 1, abrasion. Abrasion is destruction of the superficial layer of skin only. There is interruption of the superficial skin, usually caused by light frictional forces and usually seen among children. There is minor or no bleeding because of the capillary nature of blood vessels, which respond well also to the pressure application, but it's quite painful due to involvement of the terminal nerve endings, and most commonly seen among children, as we said, especially on their elbows and knee from the rough play. Abrasion is also encountered on the tip of the nose, lip, cheeks, and chin in patients who have exposed to intra-alveolar trauma. The abrasion should be thoroughly cleansed to remove the foreign material. Surgical hand and soap and copious saline irrigation should be used for the debridement and cleaning of these wounds, and all particle foreign material should be removed before attempt management of these conditions. Healing of the superficial layer usually occurs from the periphery towards the center through the growth of new epithelial cells. The most important thing, the management of abrasion, especially the deep ones, is to remove or debride roughly the wound from any foreign body or discolorations or devitalized tissue to avoid leaving a permanent tattoo within the tissues after complete healing, meaning that after debridement and removal of foreign body, we should apply an antiseptic and apply a topical antibiotic, and systemic antibiotic usually is unnecessary. Just rough debridement and topical antibiotic usually is enough. Second most common injury is contusions. On the contrary of abrasions, in contusions there is no break in the superficial skin or epithelium, but rather the tissue disruption is within the tissues below the epidermis or below the skin, where the minor bleeding from the minor small blood vessels. The bleeding may be inside the dermis or immediately below the epidermis or deep approaching the muscles, which subtypes are named intradermal, subcutaneous, or deep. Contusions. The factors affecting the color of contusion include the depth of bleeding inside the tissues, the amount of extravasated or bleeding, if the wound is presented early, it can be prevented or diminished by application of ice or pressure on the wound to decrease the amount of bleeding and the size of hematoma. And if the contusion doesn't stop expanding, meaning that there is an underlying blood vessel still bleeding, so an exploration, surgical exploration and ligation of the blood vessel is necessary. There is no need for antibiotics systemically except there is break of submucosal hematoma into the oral cavity due to the microbial nature of the oral cavity. Here is demonstration for the difference between abrasion, contusion, and laceration. Here is abrasion, there is a break in the superficial epithelium, and contusion, there is no break in the superficial epithelium, but there is bleeding from subcutaneous tissues. And here is laceration, fish sharp, clean cut in the overlying skin, and we'll discuss it later. In laceration, there is tear of the epithelial or subepithelial tissues, could be superficial or deep also, caused by a sharp object or blunt force to a broad surface area beyond its limits of elasticity, and usually associated with dentoalveolar trauma because of involvement of the sharp bony edges that cause laceration to the overlying mucosa. And it's managed by 4 major steps, beginning with cleansing, debridement of devitalized tissue and any foreign bodies, hemostasis, and final closure. Here is the laceration of the upper or lower lip. The most important tip in the management of lip laceration is to suture the tissue. If it's complete laceration, through and through from the labial side to the oral side, like in the lower lip here. The lip should be sutured here in triple layered fashion, meaning that we should suture the mucosa first, then the muscle layer, then the overlying skin or labial side of the lip. While in case of incomplete lacerations that involving skin or muscles only and involves also the vermilion border, which is the junction between the skin and the mucosa, this is the vermilion border, it should be repositioned first by a key stitch, then the remainder of sutures performed later after it, for ideal placement of the skin to the skin and mucosa to mucosa, and to avoid step deformity in the lip. Here, to repeat again, the oral mucosa is closed first on the oral side by silk or resorbable suture, and the second step is to close the muscle layer with interrupted resorbable suture, and finally the dermal layer with resorbable or non-resorbable suture.